maybe you just don't get it. What you're doing, you got my world, got it going crazy, and I don't wanna let you down. Oh no, if we got a problem we can work it out. Cause I've been searching high and low for someone like you. Cause you can't just love anyone. I've been searching high and low. I'm so glad I found you. I gotta keep you near, right here with me. Yeah. Cause every little thing we do makes life go on and on. Goes on and on.
Hey guys, so we are on our way to my appointment with the surgeon. Like we spoke about in our last video, I kind of like roughly mentioned it. But
you talked about why she has braces on there. Remember?
These beautiful braces.
Don't do that.
Yes, I can do that. They'll be off soon, and I'll have a perfect smile. Yeah. But yeah, so we're going to see the surgeon. It's probably our last appointment before surgery, so we're gonna get all the information that we need to get. We're gonna ask all the questions that we need to ask. My mom is gonna also be with us because
oh, she's going?
Yeah.
Oh shit. Guys, she's having corrective jaw surgery. I don't know the right word for it, the right doctor word.
I can't even tell you guys. I can explain to you guys what's up with my jaw. So
she has to break both her jaws. Yeah. Align it. That's scary.
I don't know if you guys ever like noticed, but like my side profile is like terrible. It's not why I'm doing it. It kind of is. It's probably what has driven me to like okay it and do it, because for years I've known that there's something wrong with my jaw, like years. But I've always been afraid, like even to just get braces. Like when I was young, I was just like, nope, I'm not doing nothing with my jaw. I'm not getting braces. It was like a no for sure. And maybe as you get older, and I don't know, it's just like
I don't know why you waited so long for.
I don't know either. I think maybe until like I really started noticing like how bad my side profile was.
How bad her snoring is.
That too.
Snoring.
It's really bad, and it's always been bad, but I think like even as like I gained weight, or maybe even as I got pregnant, like it got worse.
Yeah, your last pregnancy was bad.
Yeah, so that's why I think I finally have the guts to go ahead and do this. The problem is that my bottom jaw is back. It's too far back. Like it's not in the right place, right? So it's obviously it's too far back that it blocks my airwaves. And if you guys look at my side profile, like you'll notice that like I don't have a nice profile, because this needs to come out more. And my top jaw, oh, this guy's stuck here. My top jaw is like slanted. It's like not centered. So if you guys can see.
I don't think you gotta do all that.
Yes. It's not centered. So they're gonna center that, but it's also like on a slant. So they also have to
break it,
cut a piece out to straighten it. Yeah, like it's there's a lot that's gonna go on.
We're laughing and smiling, but it's a serious procedure.
Yeah. I'm laughing so that I don't get nervous and scared. But yeah, so today we're gonna get all the information that we have to get so that we can move ahead with surgery, which is in a month.
Alright, so it's our last appointment.
Yeah.
But they might be doing some 3D thing today. I don't know if it's today or
Friday.
Another different type of specialist appointment, but we get a 3D image of what she will look like after surgery.
Yeah.
So that's freaky.
Not freaky, it's cool. Like yeah, you will get like all these x-rays and 3D images done to show like what they're gonna do, and then how I'm gonna look afterwards, because I will look different. I'm okay with that. Are you okay with that?
I don't know, let's see what the 3D image shows. No,
So yeah, we'll keep you guys posted. I'm not sure if they're gonna let us film inside the doctor's office, but we'll try. And
get ready for this journey with us, guys, or with Carlo. So she's gonna be beat up for a while. So
I'm gonna be like bruised and swollen, and I'm not gonna be able to guys.
She's gonna be wrapped with bandages.
Yeah, I'm not gonna be wired shut. Well, they've said 99% I will not be wired shut. But guys, my biggest sadness is that I'm not gonna be able to talk to my kids. Like, the girls are probably fine with that. They won't hear me screaming and telling them to do anything, but I feel so bad for Isaiah. So I have plans to like get him a book with my voice or a teddy bear. He can press a button and hear me. But I'm sad. I don't know, but like, I just don't know.
Let's hope not.
And yeah, my diet's gonna be fun from what I hear. It's like a liquid diet.
You're getting mush.
No, it's liquid diet for the first 2 weeks, I think. And the first couple days, it's like clear fluids. So like that's like just like apple juice and clear like
chicken noodle soup.
No, not even chicken noodle soup. It's just like the clear broth. Like there can't be anything in it. It's just like
clear broth. Hot water.
Yeah. And then it's gonna be like liquids, like smoothies and mushed up soup, which I'm not gonna be able to do. Guys, this is another one of my fears, is that I am so finicky with food. Like, I'm so picky. Textures are a big thing for me. So my biggest fear is having to throw up and not being able to do that, or throwing up in my mouth and like then doing what, because I can't open my mouth.
You bought a vitamin stick. No excuses. You gotta figure out something.
Yes, like smoothies and stuff, but I just don't know what I'm gonna do with like soups and stuff like that. Ugh. I don't know. No, I hate tomato soup. But yeah, smoothies probably will be my thing, and like protein shakes. And I was reading today, actually, like they say like you have to stock up on like Ensure or Boost or something like that, like those protein drinks. So yeah, it's gonna be fun. But the funnest part is gonna be that I'm gonna go this whole month just eating whatever I want. With Philip taking me to whatever restaurant I want to go to. Right?
Sure.
Yeah, so we'll keep you guys posted. We'll start filming soon. Hopefully we can film in the doctor's office. But if we can't, we will let you know what happens. We'll see you guys later. Okay guys, so we are in the doctor's office. They have done x-rays and pictures. We probably won't be able to videotape once the doctor gets in. But we have my mama. We've asked all the questions we needed to ask. I think there's a few that we forgot. One or two. We have to see what kind of spices we can put in the food that I can eat. It seems like they've showed me who my best friend is going to be for the next couple of weeks. I will be eating anything that can fit in here and can come out through this straw. Yep. I'm gonna be losing weight, that's for sure. So she's done all the pictures. This is her beautiful background. And I can't wait to like see all she did all these like side profiles and all these like stretches with all these tools.
She stretch your face?
Yeah. I used these like plastic things. Then I had to like stretch, put in there.
I use this tool.
You use this tool? Don't touch it.
I have one in my car.
Oh yeah, those tools. I had to use those things to stretch my cheeks and have them take pictures. So yeah, the doctor will be in here soon, and then we'll ask him what we gotta ask, see what he needs to say, and we'll talk to you guys later.
So I want you to kind of look eye level with the horizon there and lift your chin. Perfect, okay. What I want you to do is bite down your regular bite, how you normally close your teeth together. I want you to relax your lips though. It's gonna look like this. So make sure you're still biting, okay? But don't force your lips closed, okay? So you're gonna stay nice and still for just
Okay guys, so we have left the doctor's. Everything seems pretty clear. Straightforward. Pretty confident in the surgeon. He seems like it's a
routine.
Yeah, like a normal routine procedure for him. So it's nothing new. So yeah, I think now it's just a waiting game. I have an appointment on Friday with another doctor who is the expert at x-rays, and it seems like we're gonna be doing like a 3D x-ray, and I think they showed me like how everything gets put together, all the movements and things that they need to do, and see how it will all end up. The doctor's pretty confident that everything is normal, right? Like, what was it he was saying? Like my anatomy?
Yeah, you shouldn't have a problem with healing or any concerns of his. He's pretty much good with.
Yeah. And when I went in there, they were telling me I'm gonna have like a 3-part surgery, and I was like, what? Like 3 sections? It's like lower, upper, and chin. So one of the things that he was saying is, depending on, he needs to bring out my lower chin, my lower jaw, a certain amount of millimeters in order to open up my airways. And then depending on how that goes, he might need to bring out my upper jaw, and depending how all that like falls in place, he might have to cut my chin and pull it out. But I don't know if he's gonna leave all that till the day of and decide.
That would depend on.
Oh yeah, once they get everything together.
The appointment Friday that we have with the ultrasound, not the ultrasound, the
X-rays, yeah.
I think with that information and whatever information he got today, he has enough to kind of simulate what you're gonna look like, so he'll be able to play with it from there.
Yeah. So
it's getting real, guys.
For who? For you? For me?
For me too.
I'm trying not to get nervous. Really trying not to get nervous. He said
I have to go get a nurse scrub or something to wear.
Oh, a scrub to be my nurse. Oh, we got I think I showed you guys. This is gonna be my best friend. This is what I'm gonna be drinking out of. So anything that I can go through here and come out through here is what I'm gonna be living off of.
It's not a regular straw.
No, it's hard.
You gotta you can get it from squeezing.
Only
you don't
squeezing.
use your jaw muscles.
I can feel the air.
Yeah, that's dirty.
That's good input.
Come on, bro.
Yeah, so I think we're prepared. He told me to stay away from YouTube videos, which is one of the things that I was like, I need to start doing, is seeing watching people's journeys. And I've read a couple of
Older don't do it.
Of people's blogs and stuff like that. No, I want to be prepared. I want to know what to expect. But then he told me to stay away from it. And he told me everybody is different, and I get everybody is different, but
pretty much what he was saying was everyone's surgeon is also different.
It
seemed like he had like mad confidence.
He was like saying everybody's recovery depends on whether they did it at a what was that, educational center, or if it was a professional surgeon. So
someone that does only a couple times a year, but it seems like this guy's super experienced and does it like, it seems like on a weekly basis. It seems like he has a story about last week and this week and a month ago, so it seems like he does it all the time. So we have confidence. I have confidence in
too.
Pretty cool.
Yep. So that's it for today. We'll see what happens on Friday. And then after Friday, that's it. It's a waiting game. It's preparing ourselves mentally, physically, preparing the house, and just getting everything that I need for my overnight stay, for
2 nights. It's gonna be a 2-night stay.
yeah. And we're gonna be back at the hospital where I had Isaiah. Yay! It's a nice hospital.
You remember to call. Make sure you get that private room.
So let me just make sure I get a private room so that he has a bed. But yeah, so guys, stay tuned for the next part. Then I'll be talking about my prep, and then it'll be surgery. So we'll keep you guys posted with everything that we do and everything that goes on. But yeah, stay tuned.
And if you're excited as we are, make sure you like, comment, and share this video. Until next time, back with another video.
See ya.
Cause every little thing we do makes love go on and on.